The AMAROS study, radiotherapy or surgery of the axilla after a positive sentinel node in breast cancer, EORTC 10981 22023 AMAROS, which was published by Donker et al. In Lancet Oncology in 2014, randomized women with a T1 to T2 breast cancer without palpable lymphadenopathy, tumors up to 5 centimeters. Patients were randomized up front and underwent surgery plus sentinel lymph node dissection. Surgery was either mastectomy in 18% of the patients or breast conserving therapy in 82% of the patients. After surgery, 1,425 patients were found to have positive sentinel lymph node. Of these, 744 patients underwent completion axillary dissection and 681 underwent radiation therapy to the lymph node on top of the breast or chest wall. The lymph node included axillary levels 1 to 3 and medial part of the supraclavicular fossa. Of those who underwent axillary dissection, 1/3 of them, 220 patients, were found to have positive lymph nodes. So the outcome at 5 years, axillary lymph node recurrence happened in 4 patients in the axillary dissection versus 7 in the radiation therapy alone. Lymphedema was much higher in the axillary dissection, 23% versus 11% in radiation alone, statistically significant. Disease-free survival at 5 years was not statistically significant, 86.9 versus 82.7%, and overall survival was not statistically significant, 93.3% versus 92.5%. Thank you.